Hi, Namaskar. So we welcome you all on behalf of Kamalnayan Bajaj Hospital. Myself, Dr. Ajay Rote Medical Director of Kamalnayan Bajaj Hospital. We are welcoming you to this new edition of Bajaj Pulse, which is an health education platform. And we have today with us eminent speakers and senior clinicians to guide you on this one of the very important topics, which is very relevant and timely. That is basically how to ensure adequate winter care. And as Kamalnayan Bajaj Hospital, we focus on preventive aspects more. We want that patients fall ill less rather than coming to hospital and getting admitted, for which we are actually already ready. But we want that there is prevention of diseases, especially in this winter season. So with me today is Dr. Mangala Borkar madam, who is a very senior physician. She is now joined Kamalnayan Bajaj Hospital as a full-time head of the department of the Geriatrics department. She is recognized as one of the pioneers in the department. She is one of the first experts in the field of geriatrics, that is the care of the senior citizens. Then Dr. Shrikant Sahastrabuddhe, who is a senior chest physician with more than 24 years of experience and is an intensive care specialist also. Dr. Nikhil Pathak, who is a senior pediatrician and a neonatologist. All of them are associated with Kamalnayan Bajaj Hospital as full-time consultants. So as you can see that we have got a range of consultants starting from pediatrics to geriatrics. So now we'll coming back to our topic, that is winter care. The first question to Dr. Borkar madam. Ma'am, we often see that during winter it is a very difficult time for the senior citizens, for the geriatric patients, geriatric population. So what are those micro signals which the family member should look at that will point that the condition of the senior citizens is deteriorating and we need to take immediate action?
As one ages, all the organs start aging at various rates in different persons, and the reserve capacity of that person becomes less. So the immunity decreases and the chance of getting various infections or other illnesses increases. Also, the senior citizens have other problems, comorbidities like diabetes, hypertension, maybe heart disease, lung diseases. And due to that, in winter, otherwise it's a healthy season. But for seniors, particularly for the respiratory system, as well as for joints, the skin, for all these things, the reserve is less. So there is more chance of getting infections. So even a minor cough or decrease in the movements, mobility, a complaint of exhaustion, fatigue.
Very important.
Yes. Or not eating properly, or maybe a weight loss may be there. So maybe balance problem may be there. So anything of these, if any of these symptoms are noticed, then one should pay attention to that, because they are the signs of frailty in elderly persons.
Right. Very important, ma'am. Very nicely you have pointed out, and the signals at which the caregiver should look at. Dr. Shrikant, there has been like during this season that there is a change in the external as well as internal environment. So like what are those factors which make the patients predisposed to exacerbation of respiratory illnesses in this era?
Yes, sir. So as we know that in winters, usually outside air is like cold, and majority of times the overall the quality of the air is dry. So whenever there is a dry air, we know that the normal ciliary functions, starting from the nasopharynx, then to the oropharynx and then laryngopharynx, is hampered, and the normal ciliary functions they get
impaired.
So because of this, of course, the driving out of the normal viruses, which happens otherwise, doesn't happen in this cold air, and that is one of the predominant reason why anyone gets affected by these viruses commonly.
Absolutely.
Number two is, of course, the indoor environment. We usually have this behavioral change which naturally happens in houses to close windows, close doors as much as possible to protect ourselves from the cold, and then it actually indirectly hampers the ventilation. It will affect the humidity which is to be maintained inside the house, which is normally should be about 40 to 60%, but it comes it gets affected. It doesn't maintains to that level,
Yeah.
which will again prevent anyone from getting affected.
Yeah.
Number three is of course the exposure to allergens or dust, mites, the blankets which come out in this season,
Yeah.
and then
Yeah.
especially those who are asthmatics or who are sensitive to these allergens would get exacerbations very often
Yeah.
because of these factors. And of course, as we know that there are viruses anyways in the environment, but because of these environmental and behavioral changes, the viruses thrive on this environment more than maybe a summer or a rainy season,
Rainy
and
season.
that is why there is a preponderance of these viral infections more in this season.
Very important. But these are the changes which, as you have mentioned, which can actually be implemented to maybe
Yes.
prevent the onset
Just
of
a
disease.
small
Yeah.
point, sorry to
Yeah.
just interrupt. And so we have these particulate matters which are often seen in the outdoor pollutions,
Yes.
like PM 2.5 and even the nitric oxide, or these gases in this particular season are known to remain inside that
Oh.
particular environment for a longer time. So even the outdoor pollution, along with this, the behavioral changes, which forms the major reason for getting affected.
Understood. Very well. Now, Dr. Nikhil, like pediatric, the children are miniature adults. They are not fully developed their immunity system and their barriers and even their lungs. So, like for parents, if you want to tell in very quickly, like briskly, how you can summarize the do's and don'ts so that children don't fall to the infections in the winter.
So we know that everyone is a little bit tense when a kid gets a cold.
Yeah.
What is more important is prevention.
Yeah.
So what we need to do is, there are simple things. First, the ambient temperature of the room should be maintained. It should not be very cold. No use of ACs and this thing. A warmness. So how do we decide? So warmness is we should have the layers of clothes. So how do we decide? So for kids, it is a simple rule: one layer more than the adult.
Okay.
So whatever you are wearing, you should, if you are feeling comfortable in that, the kid should have one more. What happens is the surface area of the kid is very large according to the body, the head surface area. So head should be always be covered. We should always look for the cleanliness. So there should be a good hand wash before, after coming to the home. There should always be a good hand wash. Anyone in the family is suffering from the URI or any viral infection, he should usually stay away from the kid or use a mask prevention in the house so they can prevent. Do's and the don'ts would be, don't let your kid roam around in the evening or when there is a cold wave going on, so that they are not exposed to this thing. Keep a watch on their appetite, how the nutrition goes. Also keep and watch for their hydration. It is important that vitamin C is known to give a protective immunity during the common cold. So use of citrus food, use of various food materials for vitamin C can be seen.
Very good. So these are all preventive tips for preventing cold and infections in kids. I'm coming back to you. Like, as we are aware that during this season, due to less of temperature, there is a disturbance of thermoregulation in these geriatric patients. So just beyond sweaters and heaters, what are the precautions that would ensure that it doesn't affect the health of the geriatric patients?
Yes, just as Dr. Pathak has mentioned.
Yeah.
So, as in the case of small children, similarly in elderly,
Yeah.
what one has to keep in mind is a proper covering of the face,
Nose, yeah.
especially in the cold weather, avoiding going out in the cold, very, very cold weather.
Okay.
Then secondly, hand washing, very important,
Very
because most of the
important.
infections can be transmitted by the
Right.
hands. And avoiding contact with persons who are having
Active infections. Yeah.
and vaccinations.
Vaccinations, very
flu
important.
vaccine,
Very important.
pneumococcal vaccine.
Yes.
These are very important,
Very
and
important.
they are recommended for seniors. So that can be advised. And good nutrition.
Good nutrition.
And in the nutrition, depending on what they are taking, what they are used to.
Yeah.
But things like adding some groundnuts, then
Okay.
it's a kut, which we say. So powdered groundnuts, which are roasted, or milk products.
Okay.
So if they are not allergic or anything to this, then in that case, these are the things which should be added. If they can have eggs or something, then it is good if they take a good nutritious diet, whatever they like and prefer, and their culture. So that is one. And exercise. So in exercise, one has to be very careful. Otherwise, what happens in winter? People suddenly decide to go out and exercise.
Yeah.
So they often have heart, lung problems, and that can aggravate, especially in winter.
Yeah.
Chances of heart attacks are
common.
There are studies which show that chances of heart attacks as well as brain strokes also are commoner in winter. So one has to be very careful. Everything in moderation. Start slowly if you are not doing it before, and just in moderation, but regularly moving the limbs, exercise, light weights, maybe even half kg or 1 kg. So even sitting in the chair, sitting in the bed, simple yogasans. So they have to use, you have to do, you are an expert of yoga. So advantage of having these exercises in a moderate degree, to a moderate degree. So that will be very useful, sir.
Just two things I would like to add. One is, as you have rightly pointed out, unaccustomed exercise should be avoided.
Sir.
That is one.
Yes.
And it has to be gradually increased.
Yes, you have to start and step up gradually.
And flu vaccination has to be done once in a year at least.
Sir. Yes.
And after somebody has an active infection, after 3 to 6 weeks, they can have the vaccine.
Yes.
If at all it is not taken in that year.
Yes.
So these are very useful preventive tips for a geriatric population. Now coming to intensive care. So in winter we see a typical pattern of patient increasing coming, and for which we need a ICU care. So what are those patterns, and are some of them are preventable so that they need not be shifted, because ICU is one thing which will increase the anxiety pattern of everybody. Yeah.
So prevention always remains the mainstay for many diseases, and it has been discussed in all spectrum of diseases, starting from pediatric and to the geriatric. And there would be few repetitions again. So I'll start with prevention again, as Dr. Pathak as well as Borkar madam said about using the masks. Now using mask has no taboo or anything of that sort. Earlier people used to feel about it, but COVID has taught us so many good things. Along with the COVID appropriate behaviors, avoiding the noisy and the crowded areas as much as possible, using the hand washes and the hand hygiene techniques even at home, where our grandparents used to teach us when we were children, and they were so very true. Along with that, of course, vaccination again as an important, impactful mitigatory factor to all those who have certain diseases. And of course, hydration, I would
very important.
Point towards that particular aspect where people neglect that having that hydration of about 2.5 to 3 liters, because again it becomes dry and people tend to drink less water. So one of the predominant diseases in this particular illness, as we know, is acute exacerbations of chronic obstructive pulmonary diseases, or even status asthmaticus in asthmatics who are already on bronchodilators, on steroid inhalers. So we need to ensure that they are sticking to the schedule of those drugs, especially in this season where they know, most of the patients know that now this is a bad time for them. So they themselves become aware of the vaccination schedule, of the inhalation, the LABA and the LAMA combinations which we usually prescribe them. So they need to stick to the specialist advices and the prescriptions, to their timings, and of course taking due precautions while traveling, and of course going regularly to their consultants or doctors for their advices and follow-ups, and regular follow-ups where they should not miss, so as to not to land in a critical situation. So this is probably the first category of common patients who may come to the ICU in this particular season. The next is, of course, we saw the viral fevers and the viral pneumonias, including COVID. Now people are not fearful about listening to any COVID who is detected just
Yeah.
once in a while. But yes, there are few viruses like H1N1, all the respiratory syncytial and the pneumococcal bacteria and the pneumonias which we see. Again, the vaccination forms the mainstay to mitigate these problems as much as possible.
Right.
Having said that, it doesn't mean that someone who is vaccinated will never get a pneumonia.
Correct.
It depends on immunity, as
Right.
Madam said, and it always depends upon the comorbidities if the patient have. Of course, ensuring whether you have a good ventilation, as Dr. Pathak very clearly stated about whether you have a good ventilation. As far as possible, the functioning of HEPA filters, whether it can be simulated at as much as possible, where you don't have the air which is infected. Also the AC, which we know that you get Loeffler's pneumonias and these kind of thing. Even Legionella can get you get from the ACs. So this is another category. And a third category, probably predominantly, I would say that someone who has an underlying heart disease is likely to get hospitalized in an intensive care unit with heart failures. Recurrent heart failures are common in winter season, and of course hypothermia related illnesses which can get exacerbated with this kind of temperature differences. And of course ICU care remains the same, but probably I will put these as 1, 2, 3.
Very good. Very nicely you have pointed out. I would just like to add one aspect as a diabetologist, because in all these scenarios, it is to be ensured that diabetes control is adequate. That's basic, very important, because uncontrolled diabetes will predispose them to. And another thing is, even if somebody has some fever, or there is something called as a sick day rule. So those who are taking insulin or those who are on diabetic medications, they should not refrain from taking those medications. Of course, under medical supervision and after guidance of their consultants. What people usually do, that those who are on insulin, when they are fever, they will skip the insulin, and actually it will exacerbate, or it will increase hypoglycemia, predispose them to many infections. So one should ensure that diabetes control is adequate, also to ensure this and follow the sick day rules, as you very rightly pointed out the importance of hydration, because these patients are likely to get dehydrated very fast. Very important. Dr. Nikhil, last question to you. For parents, not as a rule of thumb, it could be very simple. How to differentiate between a simple cold or an infection for which immediate consultation is required?
So for parents, for kids, everything is different from the adults. So a common cold is very common. So having 5 to 6 episodes per year is considered to be normal for the kids. So for every cold, you did not rush to the hospital.
Right.
What is more important is we look at the red flag signs. So when you have to consult your doctor.
Right.
So one is any fever which is lasting for more than 2 days, in spite of medication, you should always consult your doctor.
Very important.
One important thing is always measure the temperature, because what happens is the kid's head is always a little bit warmer.
Okay.
The extremities are always warmer. So you might feel that the child is having fever, but when you measure it on the thermometer, it is not there.
Yeah.
So we should keep that in mind. We should always take temperature for the kid whenever you feel that the child is having fever. The other important thing would be anything which is causing a respiratory distress, anything which is causing an increased respiratory rate, the child is not taking food properly or is lethargic, sleeping well. These are all the red signs where you should always consult your doctor in an emergency.
Okay.
So what I would prefer is just observe for 2 days. Not all cold require admissions, not all cold. The most common things are the allergies. Allergic cough is most common. But we have to see that if your child is more allergic, he is more prone to have an asthma-like attack, you should consult your doctor in an emergency.
Very important, very nicely. So all our experts have clearly told the preventive strategies from across pediatrics up to geriatrics to ensure that this healthy season remains healthy for everyone in the family. So we sincerely thank all our consultants. Thank you very much, and we wish all of you a very healthy winter. And if at all any consultation, any help is required, please count on us. We are at Kamalnayan Bajaj Hospital here to serve you all. Thank you very much. Thank you.